I'm Dr. Christina Martinez. I'm going to guide you on how to administer the adrenal salivary test. Okay, so before you start, you want to make sure that you have all the components necessary. So I'm going to go through those with you real quick. I want to make sure that there's a requisition form in your kit, and I'm going to say this at the end as well because it's so important, but you want to make sure to fill out the necessary information. So you're going to be responsible for section 1, all your patient information, make sure to fill that out. And then down on the bottom left, there is payment information. Just make sure that that's filled out as well. We're responsible for all other sections, okay? You have your instruction manual. I'm going to be as thorough as possible, but go ahead and read through this, and it'll just reiterate everything that I'm saying. Okay, so read through this thoroughly. You're going to have a Ziploc bag with 5 blue-capped vials and an absorbent pad. And then you're going to have your box and a mailing label. Okay, so for collection, before you start, 5 days before collection, it's really important that you stop any sublingual medication. So any medication that you take that you put in your mouth and you just let absorb, important to stop that. Your doctor will probably mention it to you, and if you have any questions or concerns about it, or if you are on one of these medications and it hasn't been mentioned by your doctor, go ahead and contact us, okay? And then 2 days before collection, it may be important for you to stop some of your hormone medications if you are on any. And your doctor most likely will cover which medications you stop or start, but because hormones can affect the results, it is important that you stop some of them. So if your doctor hasn't gone over specifically which hormone medications you stop or start and you are on some hormone medications, contact us, make sure that's all cleared up, okay? So you want to collect all your samples on the same day. So plan out one testing day, okay? All your samples are going to be done on the same day. And the times of the samples, you're going to do 4 collections throughout the day. 1 in the morning, early afternoon, late afternoon, and evening. Recommended times. The morning sample should be done between 6 a.m. and 8 a.m. within 30 minutes of waking. And this one should be a fasting sample. So no food or beverage within 6 to 8 hours of that first sample, okay? The second early afternoon sample should be done between 11 a.m. and 1 p.m. The third sample should be done between 3 p.m. and 5 p.m. And then your nighttime sample should be done between 10 p.m. and midnight. If any of these times don't work for you for any extraneous reason, just let your doctor know and we'll figure it out, okay? But those are the 4 recommended sample times. Now, before you do each sample, an hour before each sample, you want to make sure not to smoke, not to brush your teeth, not to use any mouthwash, and not to eat any food or beverage, okay? So that's an hour before you do each sample. And 30 seconds before you do the sample, go ahead and rinse your mouth out just with some cold water, swish around for 30 seconds, and spit out. Okay, now you're ready to collect. Here's how you collect your samples. So go ahead and take out the appropriate vial. They're all labeled. So there's one morning, noon, mid-afternoon, and nighttime, and they're all labeled, okay? You want to take out the absorbent cotton inside, and you want to place this under your tongue, and you're going to let it sit there until it is saturated with saliva. Okay, it may take up to 5 minutes, so just be really patient. Make sure it's really saturated before you take it out. Once it's done, go ahead and put it back into the vial, close it, and label your vial with your name and date of birth. That's really important that each vial is labeled with name and date of birth. They won't be able to process it and if it's not, okay? So once you have all of your 4 saliva samples done, you're going to stick them back into the Ziploc bag. And just note that this came with 5 vials, but more than likely you're only going to be using 4 of them. There is an extra vial in case your doctor wants an extra saliva sample at some other time of the day. It's available, but if you haven't been instructed to do another sample, just do the 4 morning, early afternoon, late afternoon, and nighttime. Okay, so most likely you won't be using what they call the H vial. Okay, so then this, and each time you do your saliva samples, you're gonna put them in the refrigerator, and they're gonna stay in the refrigerator until it's time to ship out, okay? So you can have them in the refrigerator for up to 3 days before you ship them out. So if it's a holiday or weekend, it gives you a little bit of leeway there, okay? Take them out of the refrigerator. Once you're ready to ship, you're gonna put them in the box. You're gonna put the requisition form in there. It's all filled out. And then this label is actually gonna go straight on the box like that, and it's ready to ship out. It's a UPS shipping label, so you wanna take it to a UPS shipping place, or you're welcome to bring it in here and we'll be happy to ship it out for you. Okay, happy testing. Thank you so much. Bye-bye.